Welcome back, everyone, to another episode of Grow Your Path to Wellness. If this is your first time listening, my co-host Amanda and we host a new wellness guest every week, and we release our new episodes every Sunday. If you missed last week, it was Amanda's first week back from maternity leave, and we hosted a good friend, another fellow TikTok creator, Katie Ridings, and she shared, she was very vulnerable, shared some of her own experience as far as being a consumer of mental health treatment and also working in the mental health field. So if you missed that, make sure you go back and check that out. This week we have another, we talk about TikTok every episode, and apparently, we've made such a good community and network from that app, but we have another fellow content creator, Jason, also known as NotYourTherapistDude on TikTok. Jason is known for his use of humor, both in his social media platforms and his clinical work with his clients. So Jason is going to be speaking on the use of humor in therapy with us today. So welcome, Jason. Thank you for being here.
Oh, thank you guys so much for having me. I'm going to be clearing my throat all day because I'm getting over a cold, so I apologize.
So just for all of our listeners, we're a little bit of a hot mess today. And Kelsi and Jason got some sick, I don't know what, you got some ickiness going on. This is my first episode, not having someone to watch the baby. So Jason was late. Baby's been sleeping for like a half hour already. No, I'm just kidding.
I missed half it. Oh my God.
Okay. If you see me looking down on the recorded version, I'm just looking at the monitor. And if I disappear at any point, it's because baby woke up. But on that note, Jason, welcome. Please introduce yourself. Who are you?
Hello. My name is Jason. I am a licensed clinical social worker. I'm in the state of Delaware. And I have a private practice that I've been running for, I think, coming up on 10 years this month. And before that, I was a foster care, CPS, adoptions, all that stuff worker. And that's it.
Jason,
what population do you work with?
Oh, sorry.
Oh, you're good. Populations I work with mainly are from adolescents and up, because part of my clinical approach is speaking to people like they're people. So I'll be like, oh man, that really sucks. I can't be like, gosh darn, that sounds like something the Paw Patrol would have to help with. So it definitely has to be like adolescents and up, or else I just don't have that rapport.
Yes, and congrats on the 10 years in practice. You and I know we've interacted with each other on TikTok and things, but I never had gotten to gather much about your background or, your populations and stuff. So, but congrats on almost 10 years in private practice.
And my background is my couch and my wall. That was terrible. Don't laugh at that.
So you can probably see why Jason chose the topic of humor in therapy. So we're going to preface this again that Jason sent us some bullet points, as we ask all of our guests to do. And Kelsi so graciously decoded those to the best of her ability. So as we go through these bullet points, it's really just going to be a question of regurgitating back that bullet point to Jason to then explain what he means.
Sounds like marriage.
Pretty much, yeah. But the first one then is the use of humor. Like, why did you pick this topic in general, I guess, before we go into the actual bullet points? Why was this something that you found helpful?
Well, I think humor is really important because a lot of times we think of therapy as going to places so that we can be sad and, use up our spare tissues. And we forget that the point of therapy is to get to a place, no matter where we're coming from, where we can be enjoying life. And being, if not happy, then in the pursuit of happiness, because I guess I'm American. But being able to use that really helps people become a lot more comfortable with being vulnerable in a moment. Because if you're going into a situation and it's super serious, you're not going to want to open up at all because you're going to have this fear of being judged. But if I come in and I act like an idiot or say that I'm acting, and I make a lot of terrible jokes, that really helps humanize me and makes people a lot more open to exploring things that they may be on guard for. Simultaneously, I feel like it gives me a lot of credibility when I do get serious. It's like, oh, wow, this is a real moment as opposed to something that we're joking about. And just having that ability to kind of meander back and forth with it, especially when I don't know what I'm talking about.
Especially when
which is a lot.
Jason, stop. Oh my gosh. Can you paint a picture for our listeners on like what it looks like and like your approach as far as how you use humor following like negatively impacting situations, like when you're helping somebody work through those things and how you incorporate humor?
Yeah, so a big thing is, and I can't find the studies because I can't find my grad school papers, but there is science showing that if you have at the one extreme end of things, like a traumatic situation, something that we would do when we did CPS was if we had to do, like, God forbid, a removal, we would try to give the kids something like right away, like literally right away. Like if we had a stuffed animal, if we had a movie they could watch, if we had anything, and this isn't just to placate them and make them be like, oh, it's okay, because it's not, but it is to kind of help calm their nervous system so that they are able to take a greater understanding of the situation around them. And what we never do is say like, oh, it's fine, laugh at this thing, because it's not fine. You don't want to lie to people. So I do the same approach with the people that I'm lucky enough to work with, because it does help people realize that they're not dominated by a situation that feels like they're dominated by. It's kind of like the weather, how one day it can just be, or for a few days, it can be awful. And your experience is valid that it's awful, but it's not permanent. And there is an opportunity to have a breeze on a hot day or a little bit of warmth on a cold day. I'm sponsored by HVAC companies, so I have to say these things.
I love that because there was science in there, even though you're a jokester and, you know, you were talking about humor in therapy, like the science of bringing a physical object to then bring you out of the survival mode where you might dissociate and not remember that traumatic event, but still be impacted by it. It brings you to the moment, grounds you, helps validate the experience and keep you there in the present moment. And also, like you said, regulate your body a little bit, calm you down. So
Yeah,
what might, like, yeah, go ahead.
No, I'm just saying, because I used to do stand-up comedy poorly, but one of the reasons that people like are attracted to comedy is because it helps to have someone else validating what you're saying and be able to talk so that you don't have to. Like I know in therapy a lot of times, I want to hear everything my clients have to say, but if you're in a moment, whether something just happened or we're reliving something that happened, you don't want to have this pressure on you that like the spotlight's on you. So me being able to just crack an appropriate joke here or there really helps lighten the mood and take the pressure off of the client from feeling the need to perform, so to speak.
And I like, so we're making it clear here that we're not using humor to deflect or minimize or, like make it less uncomfortable. Like for us, it's, it's not about us, it's about our client and helping it diffuse and help them regulate before, we take things to the next step or before we start processing and even incorporating it in, throughout as well. And I think all of us as clinicians here, we have probably our own styles of using humor, or therapists are, we always talk about our dark humor or things like that. But there's a time and a place, and we're not saying we're using it to, like I said, to, deflect or minimize what the client's going through.
Absolutely, because a big thing with humor is if it's used incorrectly, whether it's at a party or like an actual dad joke or just something cringeworthy on TV, like that's uncomfortable. So if you imagine that in like the context of therapy, we as clinicians can't you can't wield humor in a way that you don't know what you're doing, and especially like Kelsi just said, like when and how to do it, or else you're going to be doing much more harm than good. Because if someone comes in who's like, oh, I failed a test, and it's like, wow, have you tried not being dumb? That's not going to help at all. So you don't
Yeah, I
want
was
to
gonna
use
say,
it in
like,
context.
any intervention you have to know when to use appropriately. That's the art of being a therapist. Yeah.
Mm-hmm.
And so, and then my brain just kind of went here, like thinking about like when it's appropriate to use, as far as like the neurodiverse population, where those jokes might not be understood and they might take it, seriously. Is that something that you've learned to kind of dish it out differently, or do you just avoid humor in those situations where you don't think it'll be taken how you're intending?
No, that's a really good point, because like you said, like like if it's taken how I'm intending, because like a big rule of comedy is know your audience, because it's very similar to like the customer's always right. So I could have a 7:30 show and I tell a joke and it kills. That joke is hilarious. And then at my 9 o'clock show, I tell the same exact joke and it bombs. That joke is no longer hilarious. The content didn't change, the delivery didn't change. It's because it wasn't appropriate for the audience. So Amanda, like you're saying, you want it to be appropriate, and Kelsi, you too, like appropriate intervention for who you're working with and who you're working with in that specific moment. Because I might talk to you today and things are great, but then 20 minutes in, something happens, maybe you get a text or something comes to mind, and now it's not a joking time and it's not something we can use. So like with a neurodiverse population, that's going to happen, in that we need to, or I need to be able to know my audience and know what's going to be effective and when.
And do you mind sharing with us how, like, if you've ever had one of those moments, how we're therapists, we're humans, and we're working with humans. So if you've ever like had a rupture, what we would call a rupture in the therapeutic relationship, or where a client came back a following session and mentioned something that was said during session that maybe impacted them in an unhelpful way, or I guess what it would look like for you to kind of repair a rupture with in a client relationship.
Absolutely. Sometimes I will do that on purpose if I have someone who we're working on with self-assertion. Like if I know that there's a topic that's not going to do like real harm, like kind of like a little pinch, not something that's going to be like cause a lot of pain for somebody, and not like a physical pinch. But a topic that we've been working on and making a little bit of a joke and seeing like, how are you going to respond? Because if you can do that with me and we have this type of intimate relationship, it's going to be a lot easier to stand up to your bully or your partner or your teacher, a parent. And this is especially appropriate for teenagers. But sometimes it's not on purpose, and clients will say, hey, can we not joke about that? Or that really bothered me. Which, as Jason is like, ouch, in the feels. But as a clinician, it's like, this is awesome. You are saying how you're feeling. You are standing up for yourself. You're letting someone know that just because they don't intend to do something wrong doesn't make it okay for them to do something wrong. So learning from those experiences, I do tend to check in a little bit more often and say like, at the beginning of a session, hey, do you want this to be a lot of conversation? Do you want me to listen? Do you want it to be a little bit more serious? And then also, like we were talking about, reading the room, knowing your audience as things are progressing. So if someone's like crying because their spouse is leaving them, I'm not going to be like making a joke regarding that, because that's not appropriate in that moment. So it really does have to be used as an intervention, just like any other therapeutic technique. You have to know when it's appropriate, when it's not, and if it doesn't work for the client, it's our responsibility as the clinician to work to make that better.
And I love how you brought up, not only do we do it as, helping a client build skills, if that is, part of what it is that we've been working on, but then also creating that safe space for them to practice, essentially, hey, the difference of intention versus impact, and then how do they communicate how things have impacted them to other people.
Mm-hmm. Exactly, because everything, and I try to work with my clients a lot on this, is that there's no such thing as really making a mistake. It's just practicing to get it better next time. So if I can model that as a person, it's going to be much easier for them to buy into what I'm saying and to be able to model that in session and utilize that outside of session.
Yeah, I mean, and one of my favorite quotes is, you don't know if you don't try. So like, of course, when you're learning something new, you're gonna slip. You're going to make mistakes. Otherwise, you'll never be able to learn that new skill. It's a necessary part of the process.
Yeah, you literally just described parenting. So that's my
Exactly.
process. Shoot, I had something and then I lost it. That is not a rare event. Sorry.
It's okay. I feel you on that. What is like, obviously HIPAA covered, but like, are there examples of things that you could, because even just myself as a therapist, I'm like, but what would he like, what would you say? Like, what would be an example of something you would say in a session? Or like, what is a situation? And then what might you say to kind of diffuse it or create more safety?
Yeah, it's so hard because it has to be like, because we all know comedic timing. Like, the timing has to be absolutely perfect. So this is one of those things where if you're not 100% you can make the shot, don't take the shot, because you don't want to screw that up, especially when it comes to diffusing a situation. So I had someone, I did actually a couple teenagers, and they were talking about feeling bullied, and we were talking about some specific things bullies were saying, and I would just like not stop it, but start a little role play about like, okay, say that to me, like what the bully said, and then I would respond just like a comedian would respond to a heckler, and kind of give them some like literal responses that they could use in the situation and demonstrate that even though it's painful, it doesn't mean that you can't use that power. It sounds terrible, but whatever. You can't use the power they're trying to exert on you against them. Kind of like in judo, like you're supposed to use the opponent's strength and speed against them. You can do the same thing when someone's insulting you, or you can do the same thing when you're in an embarrassing moment. So,
like therapeutically taking control back.
yes. And doing it in a way that's going to be socially appropriate and is going to instill confidence in the client.
Yes, because in those situations, it can be really, I don't know if it's the appropriate word, but the words today are hard. It's can be triggering for, very core limiting beliefs or schemas that client carries. So teaching them to be able to, in that moment, separate from that.
Yeah, and just it is very much like literal long form improv, just as with any conversation. So it's knowing how to not break the seriousness of the topic and not break the validity of what a client's saying, but to use humor to emphasize a point or to kind of provide a different perspective on what a client might be saying. Because sometimes, like, we're lucky enough to see a client have a light bulb moment that they may not be aware of. And so if we can point that out, especially do that in a way that's, and for me, do that in a way that's humorous, that really, really helps them, because then they'll remember that. You remember good jokes. And so you remember those kind of moments that you have, and it's like, oh yeah, that happened because I said the thing. And it can be so just, I don't know, like, I don't know if you guys have ever seen Tiger Woods when he makes a shot, like, or sings. So I don't golf, but when he does it, he goes like, yeah, like that kind of thing. I just have those internal and sometimes external moments when they like get it, and it's just like, yes. And then we spend
that makes everything we do worthwhile.
Exactly. And then I'll spend maybe 3-4 minutes telling them how funny what I said was, and just break down why it was funny. And no, I'm just kidding. I don't do that. It's like 6-7 minutes.
I mean, they are paying you to be a comedian, right? No,
exactly. They know what they're getting. Oh, and that's a big thing. Like, they know that going in. And I'm really glad you brought that up. In my initial like spiel at the beginning of a session, or even on like the phone call or email prior to it, because I am a solo private practice, so I don't have like an intake staff or anything. I let them know like, hey, this is my approach, this is my style, whether it's working with them or their kid, so that they know it going into it. Because you don't want to go to a concert and then find out it's Nickelback when you get there, because that's disgusting. Like, you want to be able to know what you're getting into, so that you can say, okay, this is what I want, or that doesn't sound right for me. And it's always
That's
what the client's needs are, right? So like I think of like different therapeutic approaches that are appropriate and clinically helpful as different colors. Like no color is wrong. It's just that some colors work better on some people. And so it's not personal to me if they want a very standardized approach that is by a book that they can, predict and have very, not strict homework, but very
Like
repeatable. Thank you. Yeah,
Yeah.
like a very specific structure that they can look for. Then that's not going to be me in a lot of circumstances. But if they want to feel like they're having a conversation with someone, and humor is going to be a big part of that, so they can get through things that might make them nervous or self-conscious, then I would be a really good fit for them. But if I'm not a good fit, it doesn't say anything about me, and it doesn't say anything about the client. It's just this isn't the right color for one or both of us, and that's fine.
I'm glad you said that, because for people that are listening that aren't in the field and are maybe more of a consumer, that is true informed consent. And I think oftentimes in the health professions in general, that's taken for granted. I was actually just talking to someone about that yesterday. Like, when I was pregnant, I was going to like all these different specialists to prepare for birth, and one of them was a pelvic floor specialist, and she was the most informed consent person I had been to. Like, she was like, okay, first I'm going to do this, and then you're going to feel this, and then I just want to make sure you know that this is, and it was very detailed, and she was like, I want to know, you know everything that's going to happen step by step. And I think a lot of times we go into, whether it's therapy or a medical doctor's office, and we don't have that informed consent. They just kind of do, right? And then we deal with the repercussions of it. So I appreciate you saying that. And then the other thing I thought of is how I use humor too, is like with social anxiety, I'll be like, oh, wow, yeah, they think about you that much, and they're running all those scenarios in their head, right? Like they got all these ideas about you. How much time do you spend thinking about them outside of that situation? And they're like, what? I don't know. Not at
Yeah,
all. I'm like, oh
exactly.
yeah, like like just some little humorous thing, and then they'll kind of giggle and be like, oh yeah, you're right. So you're right. Like when it sticks, when it's funny, and it like then it's a light bulb too, right?
Yes, absolutely. And because like you'll remember, I love what you said about the informed consent part too, because a lot of times, and I'm guilty of this. This isn't like the bad ones. This is everyone. Like we have our thing and we know what we're doing, but it's hard to remember at times that the client doesn't know that. So I might be at like like let's pretend step 4 of whatever intervention that I know that I'm doing, but the client doesn't know. So I don't know if they are doing it right, if I'm doing it right. They don't know that I say this to everybody because they aren't anybody else. So it is really, really, really important to keep letting people know what's going to happen. My wife and I did IVF. Well, she did IVF. And all the things that she would experience because you're talking about like getting ready for pregnancy and everything, and I won't get into too much detail, but everything was just a little bit of pressure, just a little bit of pressure. And I'm like watching and I'm like, that's not a little bit of pressure. Like, what are you talking about? But you could tell that like the tech or the nurse or the PA or the doctor, extremely well intended, like this is the 60th time they're doing that this week. But for my wife, it's like, this is the first time I'm doing it ever. And it's hard to keep that in mind as a clinician, that it's not just a thing, it's like somebody's life. So I'm really glad you brought that up. Thank you.
I love that. I can't say we've had anybody use an IVF, bless your wife's soul, like, and as women, I feel like so much of our healthcare, this is not a squirrel moment, but it's always like just a little bit of pressure. And it's like, it could be very minimizing to what that person, is experiencing themselves, or, can make them feel very alone. Like, what do you mean this is happening? Like, I'm experiencing it in this way, and you're wording it to me in this way, and those things don't line up. So making sure that those things line up in sessions for our clients.
Yeah, because it is like, oh God, I'm trying to not mansplain or sound like an idiot. So I'm going to do both. So like, from my experience in like purely observation, it does seem like if someone says it's just a little bit of pressure, that you should only experience it as a little bit of pressure. Like this shouldn't be a big deal to you. So if it is, you're wrong. I have letters after my name, so I'm right. And, like when like my son just got the COVID shot, and it had to be, buddy, it's gonna be okay. It's a little prick, it like etc. to get him comfortable. But when he was upset, you had to simultaneously say, and it can be scary, and it can feel like it's really gonna hurt. That's also okay. But sometimes I feel like clinicians, whether it's through women's health or, well, not my experience, or like physical health, physical therapist, anybody in a clinical setting can say like, oh, it's no big deal, which is just like if you have issues with your parents saying, oh, stop crying, it's not a big deal. Or a teacher saying, why can't you do this? This isn't that hard. Like, we don't want to be minimizing, even if we have that best intention. So,
we want to be, validating of that and helping that person articulate and understand their own experience.
absolutely. And be able to like and have the skill to self-validate. So even if someone else says, this is no big deal, that they are not omniscient and they are not an authority on how anyone else feels, including yourself.
Mm-hmm.
And I use the same skill with parents when talking about their kids.
It was same. I do that as well. So this brought me to I was looking forward to this point in our talking points, and I feel like this is a good segue into this area here. As far as, can you explain more about how a person is unable to feel a genuine humor response at the same time they're experiencing unpleasant emotional responses?
Yeah, so the way I learned this is while I was in undergrad, before I knew that I wanted to be in this field. I was a camp counselor, and I had a kid. He was about 10 years old, and he fell and he hurt himself, and he was crying about it in a proportionate, age-appropriate way. I'm a counselor, so I knew-ish what I was doing, but I'm also like 19 at this point. And so I looked at him and I said, dude, I know this really hurts, but like, I want you to think about this. My dad poops in the toilet and doesn't flush. And then all of a sudden, like, that's the reaction, is just like starting to have, you can see like the cortisol now, like the cortisol levels diminishing. You can see them starting to have more regulation over their emotions and more of a focus on what is going on in that exact present moment. So like the bad joke or whatever. And I always imagined it like a pie chart. It was like 100% like this painful, literally painful experience. And then you inject like a joke there, even if it's just 1 percentage point, it's 99% for the pain, and then you can expand that. And so they feel more empowerment. They experience it in a, this sounds condescending, but a closer to objective form of the pain. Like, he was like, I'm dying. And I'm like, I'm pretty sure you're not dying. You're okay. But I didn't want to say you're okay because I always felt I was like talking down to people. Like trying to not distract or deflect in terms of make them irrelevant, but to show that there are simultaneously other points in life that can be funny, and that can be enjoyable. And
Yep.
it made it easier for him to talk about. And then like 3 seconds later, I made another joke, and he literally fell over laughing and hit his head, and we had to start the whole thing over. And I'm not making that up.
I was gonna say, I can tell you're not making that up. So I call that, I'm very mindfulness, based in what I do, and it sounds a lot like decentering. Like, in the moment, I'm at the center of all of this, and it's consuming me, and it is my reality. And if I can just use that, like we've said a million times already, not in an invalidating way, but in a almost just to diffuse or to decenter, so I can see it rather than being consumed by it.
Yeah, because there's a huge rule in improv. You never say no. It's always yes and that's how you continue things. So when a client feels something like that, and like I love the decentering, it's yes, you're feeling this, and this is going on too. So you go from like, again, 100% is this painful experience to this painful experience is just as big as it was, just as important, and there's something else, and this, and this, and this. And now when
It's
the
like
things aren't
DBT.
circular, I don't know what to do.
Mhm.
Yeah, it's a lot of DBT. And it's just so cool to see them be able to recognize it and have different perspectives on multiple things, because you can also do a callback. So usually, like when we make jokes, especially at the end of a routine, you'll see a comedian like refer back to a joke earlier in the set, and that helps create like an intimacy with the audience, makes it feel like an inside joke, even though it's on Netflix. And you can do that with a client, like, yeah, and that really hurt. And 2 weeks ago, we're talking about this, and that really hurt. And you felt that that was the end of the world. It seems like it hasn't been so far. Do you think that this could be, at some point, not the end of the world, too? And of course, like knowing when it's appropriate to do that, and then how to, if you're going to use humor, how to deliver it, and also how often to do it. Because if you make jokes and like that, if I'm making jokes, I think more than 30-ish% of the time, it just becomes like, come on, stop, like too
Then the
much.
person came to your comedy set and not to
Yeah,
therapy.
yeah, and um we all have like master's degrees, at least to, be in at our level of clinician. I don't do talk good. Um, but there is a level of, hey, I know stuff and I want to show you the stuff I know, but we have to make sure that we're doing it in a way that's only beneficial to the client, not to pump ourselves up. So if they start coming to my comedy show, that's not okay, because it's not about me at all, unless it's going to be therapeutically appropriate for the client. So this is when I say when we talk about like if one of my teenagers is now graduated high school, going to go to college, or someone I'm working with is going to move, and I'm not in the state in which they're licensed, the state they're in will not be one in which I'm licensed, then we talked about what to look for in a therapist. And they have to be, everything that they do has to have a point that's going to benefit you or highlight something, a skill that you can do. And it can't be about, oh yeah, I'm really smart because I know these multisyllabic words, or I can make jokes about X, Y, and Z. Like, it's not about us as clinicians. It's always about the client. So even if you're just trying to be funny, like I have kind of like that character I play on TikTok where it's like exactly what a therapist shouldn't be doing, which is like, yeah, when you're crying, can you not? Because I'm trying to make a joke here. Like that's exactly what a therapist should not be doing.
Yeah, and I'm sure like there's a progression of your humor too. Like when you first meet someone, I'm sure it's very like surface level, more about like the weather as opposed to, something personal once you get to know them. Well, I had no idea we could talk about humor in therapy for so long and go on for days about all of it. Like, honestly, when I saw this topic, I'm like, we're going to talk for like 10 minutes about how Jason makes jokes in therapy, and then it's going to be the end. But like, we could keep talking forever.
No, I would not punish you with that.
But Jason, we always ask at the end of our episodes if our guests have like any last parting words, a mantra, a joke you want to leave our audience with, to carry them into their day and into their week.
I don't. It's like, I feel like Marlin in Finding Nemo, where it's like, you're a clownfish, tell a joke. And it's like,
I was sitting here like, we're ready.
Yeah, like
I'm ready.
I'm trying to think of something that's going to be like appropriate for the setting, or but like a big thing that I found, especially as we're approaching, because this is like December 12th, the end of the semester, is telling people in a lot of settings, like just because you think you can't doesn't mean you can't, or just because you don't think you can doesn't mean you're right. There's some variation of that, because there's a lot of things right now, whether it's like the end of a semester or end of the year review, or looking back personally on how 2021 has been. like, God, I'm doomed to make these mistakes over and over. I can't do it when it comes to improvement. And it's like, yeah, I don't know about that. And my 4 favorite words with clients are, I told you so. Because it gets to be like, oh, yeah, remember when you're not getting into college? Oh, wait, you did. I told you so. It's great. It's the best feeling in the world.
I don't
And
say
only
it
when
as,
things are good.
oh yeah, I don't say it as directly as I told you so all the time, but there's so many times where I've been like, do you remember the Bob who told me that they would never blah, 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 and that they couldn't possibly do this? And now look at you. What do you even need me for? Like, that's one of my jokes is like, I don't even know what you need me for. Like, you're
Yeah.
just out here doing this thing on your own. Yeah.
Yeah, it's like, can you get something else wrong with you? Because, like, you're costing me money here. No, I'm just kidding.
Oh, that was so good. Thank you so much, Jason, for joining us. And obviously, you're welcome back anytime.
No, the honor is completely over here. Thank you guys so much for having me.
You are welcome. So next week, before we head out here, we are welcoming back another TikTok content creator, the amazing. She's been here before, Dr. Leslie Cook. We talked about, what did we talk about before? We talked about ADHD.
We had ADHD, and then being more affirming LGBTQ+.
Oh, this is her 3rd time back. Yeah.
Yeah.
So this time she's coming back to talk about something that I personally have a vested interest in, chronic pain, and specifically in the population of like ages 20 to 50. So we're really excited about that. And if you haven't
I love
already,
her. I love being her opening act, so to speak, right here.
Yes, you are. So you have to make sure you listen to her next week. And if you haven't already, please comment, give us any feedback. If you have any questions for our guests, we always pass them along. And subscribe so that you know when the next episodes are coming out. I hope everyone has a good week.
Take care,
Bye,
everyone.
everyone.
Bye.
Bye.
Bye.